Hello, everyone, and welcome to the Bear for Health podcast. This is where we talk about health, wellness, and everything in between. I'm your host, Parikshit Chindade, and today we are going to talk about a very special topic, a topic that doesn't get much attention, but the conditions can be quite consequential. So, our topic for today is chronic kidney disease, an unstated yet consequential condition. And to help us navigate through this topic, we have a very eminent speaker with us. I take a lot of pleasure to introduce Dr. Vivek Goel, who is a consultant nephrologist and transplant physician at Apollo Multi Speciality Hospital, Kolkata, to help us navigate through this topic. Welcome to the show, Dr. Goel, and really happy to have you here. So
Thank you
let's
so very much.
start with our conversation, sir. So, doctor, let's start with some perspective. How common is kidney disease, and why should people be more aware of it?
Let me tell you at the very outset that the prevalence of kidney disease is increasing day by day. Today, as we stand, the prevalence of chronic kidney disease is approximately 11%. So, every 1.1 out of 10% that you know, or out of 10 people you know, are inflicted with chronic kidney disease. That is a huge burden. And if we count the number of nephrologists, that is the super specialists who are trained to treat kidney diseases, they are only in thousands. So they are only in a handful. And we're talking about say 10 to 15 crore population of chronic kidney disease are in our very own country. So now, why is kidney disease increasing day by day? Now, again, this is a multifactorial issue, and we need to understand it from the very grassroots. So basically, what happens is everything stems from the lifestyle. Hippocrates had said in 400 BC that let thy food be thy medicine. So it all starts from what we eat. We are in the day and age of Instagram and fast moving life where we are used to consuming a lot of packaged foods, a lot of high sugar, high salt, high phosphate containing foods. All those they'll culminate into hypertension, high blood pressure, metabolic syndrome, diabetes, and which eventually lead the path to having kidney diseases. We want instant relief, so we are in the habit of popping a pill. We go to the pharmacist, we say we have a backache, we have a headache, we consume a painkiller. Again, that adds on to the renal disease. On top of that, our lifespan is increasing. So as the elderly population is increasing, their complications are getting more diagnosed. And as healthcare is getting advanced, more and more role of preventive health checkups is increasing. And so that is why people are getting picked up early. So all these and many more lead to more and more detection and prevalence of kidney diseases in our society.
Right. So thank you. I think you've set the context very nicely. And, that really brings me to my next question, which is, for a layman, what we understand is that kidneys are about filtration, but clearly they do more than that. So could you explain the overall context or the importance of kidneys from the overall or the holistic health perspective of an individual?
Yeah. So, I still remember my class 8 biology class where my biology teacher simplified life for me and he said, kidney is that organ that produces urine. And I actually went by that definition till maybe class 10 or 11 when I actually understood that kidney is a metabolic organ. It is not merely an excretory organ. It actually is the center of the orchestra of the metabolic milieu of the body, because excretion of waste products is one of the function and in turn producing urine, but it regulates the water balance of the body. That is why if you see any kidney disease, you will get to see swelling in the body because the water balance is dysregulated. It regulates the blood pressure. Most kidney diseases cause high blood pressure. It regulates the blood production by means of producing erythropoietin from the renal cortex. That is why you see kidney disease lead to anemia. It also regulates the formation of active vitamin D. That is why you see kidney disease also people also have hypovitaminosis D and subsequently low calcium. Not only this, there are a lot of other intricate functions leading to related to bone health, related to bone marrow function, even related to our sexual and other hormonal health. So actually, it is a vast subject understanding the kidneys function, and it is very very important.
Right, Dr. Goel. I think the function of kidneys, cannot be understated, and what you have said really is an eye opener for many of us. Having said that, doctor, in your opinion, who are the most vulnerable to develop a kidney disease?
So vulnerability starts, say, before even birth. How does that happen? Now, many of you might be intrigued that how, even when one is not born, how does one get a predisposition to get a CKD? And that is by means of family history. So if your mother, father, or elder sibling, that is any first degree relative, has had a chronic kidney disease or a kidney issue, you are 3 to 4 times more vulnerable to having it than the general population. Number one. Number two, those children who are born preterm, who are born low birth, who have a low birth weight, they have low nephron mass at birth. That is called nephron endowment. It's a very, very important concept that is evolving day after day. And even today, I make it a point that whenever I see a relatively younger CKD patient, I ask the birth history of the patient. Patients even say that, why, sir, why are you asking this? इससे क्या ताल्लुक है सर मेरे किडनी बीमारी का? बट जो लोग थोड़े पहले पैदा हो जाते हैं, जो लोग प्री टर्म होते हैं, उनमें नेफ्रॉन नंबर कम होता है, एंड इसी इसी कारण से उनको सीकेडी होने का रिस्क फ्यूचर में बढ़ जाता है. नेक्स्ट इज ऑब्वियसली द वेरी वेरी इंपॉर्टेंट डिजीजेस लाइक डायबिटीज, लाइक हाइपरटेंशन. दीज टू itself contribute to more than 50% of the burden of CKD. अगर किसी को रीनल कैलकुलस डिजीज है, किसी को किडनी में स्टोन है, उसे हल्के में ना ले. बहुत पेशेंट्स आते हैं, कहते हैं सर मेरे तो बहुत सालों से किडनी में स्टोन है, कभी कभी निकल जाता है, कभी कभी रह जाता है. बट बिल्कुल नहीं, वो स्टोन किडनी में इंजरी करता रहता है, और वो इन्फ्लेमेशन के द्वारा सीकेडी को प्रोग्रेस कराता है. देन ऑफ कोर्स कुछ कुछ ग्लोमेरुलर डिजीजेस हैं, जैसे कि आईजे नेफ्रोपैथी, एफएसजीएस, विच आर नॉट दैट कॉमन, विच लीड टू chronic kidney disease. And of course, last but not the least, chronic interstitial nephritis, by which is, say, the consumption of toxic metals, alternate medication, painkillers. All these are causes of chronic kidney disease.
Amazing, sir. I think in your talk, one of the points that I could understand is that you touched upon diabetes and the cardiovascular disease. So, of course, now it is many people know that there is a connection between diabetes and your CV disorders and kidney. So, could you, elaborate more on the connection and how essentially these three organ systems are interconnected?
So basically, कार्डियो, रीनल एंड डायबिटीज, हम हिंदी में कहावत है, ये एक ही थाली के चट्टे बट्टे हैं. वी ऑलवेज से दिस, एंड दिस होल्ड्स एब्सोल्युटली ट्रू फॉर ऑल द थ्री. You see a patient with diabetes and you know that one day or the other there is a 50% chance he will land up in my OPD, that is in nephrology OPD, in the next 10 years. And there is a 40% chance that he will land up in the cardiology OPD in the next 10 years, because diabetes is one. See, I always look at diabetes as not a single disease, it is a package. So for my viewers, for simple understanding, please remind yourself of a thali. If anybody has had a veg thali at a counter, you will remember that in a thali you will get a good sabzi, a well-to-do roti, but you will get a bad achar, a bad mithai, and that is how diabetes comes to you. It comes to you as a package. So it will bring along with it high blood pressure, high cholesterol levels. You will have coronary artery disease, that is blockage in the vessels. You will have protein leakage from the kidney, and you will have kidney involvement. So all this is very very important, very very important. That is why your primary prevention and secondary prevention should start very early whenever you are a patient of diabetes, and you must get thoroughly checked. It is so disheartening at times that despite living in a metropolitan city, I get to see patients who are having diabetes for 15, 20 years, but they have never undergone a renal profile. They have never undergone an ECG, and ultimately they land up in advanced renal failure or maybe advanced heart failure. So it is very, very important to consult a specialist.
Wow, I think this was quite a bit of an eye opener because as a common man, we always are cognizant about diabetes or heart related conditions. But when it comes to kidney health, in fact, not much awareness is there around this topic. And I mean, of course, there's now this age-old adage which says that prevention is better than cure. So that brings me to my next question: that what are the lifestyle changes that one should undergo to prevent or delay kidney diseases?
So let's start from the very basics. You must drink adequate amount of water. Now, by adequate, I do not mean that one should keep on drinking water from dawn to dusk, which is not practically feasible. Just drink optimal amount of water that is enough to produce to around 2.5 to 3 liters of urine. So that would say 3 to 4 liters of water you drink daily. Number one. Number two, be light on salt consumption, be light on sugar consumption, on processed food consumption, because this is very, very bad. Even a packet of packaged chips that you get in the market that contains salt more than your actually daily requirement. So just a packet of chips can get you overloaded with salt. And what we Indians are inflicted with is salt sensitive hypertension. So even little salt can add to your blood pressure. So please refrain from that. A strict no to any form of tobacco, be it gutkha, be it pan masala, be it cigarette, any form of tobacco, please refrain from them. Go for regular health checkups, especially after the age of 30. So 30 is the new 40. Earlier we would advise that after 40 you get health checkups, because a man of 32 would think that why would I get sick? Why would I get high blood pressure? But now things have changed. We see so many young onset hypertensives, young onset myocardial infarctions day in and day out. So you need to get these tests daily, and awareness is very, very important. So if you're not aware, you will always hide your eyes. So that is very, very important.
Sir, it's quite interesting that you made this comment. 30 is the new 40. I mean, a lot of the Gen Zs and the millennials always say that 40 is the new 20, but you have kind of turned it upside over its head and really rephrased it. But yeah, of course, what you say is completely logical. And of course, with the kind of lifestyle that we live, with the kind of packaged food that we consume, the age-old dynamics of balanced diet and a balanced lifestyle are somewhere getting clouded. So, now of course we are at the end of our discussion. So, in your opinion, what are the most important takeaways from this session, and what is it that you would want the audience to carry when they listen to this podcast?
So I'd like to keep things very, very simple. The chief takeaways from this podcast would be that please be aware, please be educated, don't be prejudiced, and don't live in a fool's paradise that I cannot have high blood pressure. Please, I have friends who are of my age, and it kind of hurts their ego to get their blood pressure checked when they were have a headache, because they were like कि मुझे थोड़ी ना ब्लड प्रेशर हो सकता है, मैं तो फिट हूँ. ऐसा बिल्कुल भी नहीं है. डोंट शाई अवे फ्रॉम रियलिटी. See, you always should be aware, and always prevention is better than cure. If you have any symptoms, even the slightest, as small as, say, froth in your urine, reddish urine, please get yourself checked by a specialist. And please enroll yourselves for annual preventive health checkups. And of course, the lifestyle and dietary changes go without saying. Lead a healthy lifestyle, exercise daily, work out, and I think everything will be good.
Right. Amazing. I think thank you, doctor. I think this was a amazing session. A lot of insights, and the way you kind of explained this was really amazing. So I'm sure people who are listening to this podcast will be more cognizant of their kidney health and would definitely follow some of the practical advices that you have provided. So with this, we come to an end of this podcast, and I really thank you for joining this conversation. It was really wonderful to have you with us. And I would also like to thank the audience who is watching or listening to this podcast. And to get more updates, please share, subscribe Bear for Health India on Facebook, Instagram, and YouTube. With this, I thank Dr. Goel once again for joining this conversation. I hope to interact with you in many more such conversations in the future. So, thank you so
Thank
much,
you so
Dr.
much.
Goel.
Thank you so
Pleasure
much.
meeting you.
Thank
Thank
you
you.
so much. And a big
Thank
kudos
you.
to Bears for Health India for
Thank you.
initiating this great initiative. Thank you so much.